Hello, everyone, and welcome to Rehab Podcast Weekly. Today we're diving into neck pain, two interesting cases, good posture, and best exercises.
Welcome to the deep dive. Today, we're really going headfirst into neck pain.
Yeah, it's a big topic.
It really is. And we've got a fascinating mix of sources. We've got stories from people, dealing with neck issues from different things, like that pain you get after sitting too long at a conference.
Oh yeah, definitely familiar.
Or the more sudden stuff like whiplash from a car accident. And then we also have practical guides looking at posture, specific exercises.
Right, like those deep neck flexor exercises,
Yeah.
how to fix your workspace setup, general posture tips, and even exercises for like prevention and treatment.
So our goal today, our mission for this deep dive, is to pull out the key insights from all of this.
Exactly. We want to help you understand what might be causing your neck pain, maybe how to check your own posture, and give you some practical strategies for relief and prevention.
Without getting totally bogged down in medical details.
Yeah, let's try and keep it straightforward.
Okay, so let's jump right into our first story. It's a 32-year-old accountant. He starts getting neck pain, and then it actually travels down his arm after sitting through a long conference.
A classic scenario, unfortunately.
Right. And the next day, it's spread, lower neck, between the shoulder blades, and then down the back of his arm to his middle three fingers.
Okay.
He's even waking up with pain, and computer work makes it worse. What sort of jumps out at you there, initially?
Well, the way that pain moved is really interesting. The neck and between the shoulder blade pain after sitting. That sounds like maybe a local muscle thing or, aggravated by the posture.
Makes sense.
But then the fact it radiated down the arm and specifically to those fingers, that immediately makes you think, okay, maybe there's a nerve involved.
Ah, okay.
And that pattern, it points pretty strongly towards the C7 nerve root. So the takeaway is arm pain coming from the neck isn't just some vague ache. It could be nerve compression, needs a proper look.
Right, exactly. And the physical exam findings seem to fit that picture, didn't they?
They did.
That forward head posture, his neck movement was limited, muscles were tender, and crucially, those neurological signs like a weaker triceps reflex, some muscle weakness, and less feeling in the middle finger.
Absolutely. That combination, the radiating pain, sometimes described as burning or shooting, plus those specific neurological signs, it really zeroes in on that C7 nerve root being irritated or maybe compressed. And the case study mentioned certain neck movements, like looking up or turning left, made the arm pain worse.
Yeah.
That fits too because the movements can kind of narrow the space where the nerve comes out of the spine.
Okay, that makes sense. So what about the pain in his neck itself and between the shoulder blades? The study suggested a possible lower cervical disc issue, maybe C6, C7.
Yeah, if you connect the dots, it's very likely that the neck and that interscapular pain, the bit between the shoulder blades, started from that lower cervical disc, probably C6, C7.
Which is where the C7 nerve root exits too.
It's exactly, not a coincidence.
Mm-hmm.
Irritation of the disc itself can cause that local pain, and like the study says, those deeper things like discs can refer pain to that area between the shoulder blades.
Okay.
And there was probably some inflammation involved too, given the pain was constant, worse in the mornings.
It's interesting the study also threw in other possibilities, like the small joints in the spine, the zygapophyseal joints, and maybe some neck muscles, the scalenes.
Right, and that just highlights how complex pain can be, doesn't it?
Yeah.
While the C7 nerve and the disc seem like the main culprits, it's pretty common for other structures to get involved too. Those little joints can definitely cause local pain, especially with movement. And tight scalene muscles, they can absolutely contribute to neck and arm symptoms. So yeah, often not just one single thing.
So given all that, what did his physio do initially, and were there things they had to be careful about?
Well, the first thing was definitely do no harm.
Right.
Avoid anything that flared up his symptoms, especially that nerve pain down the arm. So careful monitoring of symptoms, checking those neurological signs was key. The initial treatment was a lot about education, explaining possible causes, reassuring him that this nerve stuff often gets better.
Okay.
He was encouraged to stay active, but within his pain limits. The therapist used gentle hands-on stuff to improve movement in nearby areas, like his mid-back, the thoracic spine, maybe some gentle massage or heat for the tight muscles too.
And thinking longer term, just managing the immediate pain isn't really the whole picture, is it?
Not at all. Long-term management is all about tackling the things that likely caused the problem in the first place.
Like his job.
Exactly. For him, being an accountant looking at his workspace setup, His sitting posture was huge. Also, improving mobility in his mid-back, that thoracic mobility we mentioned, and just his general fitness levels, all key for preventing it coming back.
The outlook sounded pretty good for this kind of nerve pain, which is encouraging. But things didn't quite go to plan initially.
Yeah, this is where it gets really interesting. Despite the physio, his symptoms actually got worse. Those neurological signs became more obvious.
Oh, dear.
So that led to an MRI. And that showed a pretty significant disc herniation at C6, C7.
Ah, okay. So there was definitely something structural going on.
Yes, he ended up being prescribed oral steroids, and they even mentioned surgery as an option if the muscle weakness kept getting worse or the pain just wouldn't quit.
Wow.
It really shows how important it is to recognize when conservative treatment isn't cutting it, and maybe it's time for more detailed imaging to see exactly what's happening.
That makes total sense. Okay, let's completely switch gears now. Our second case. A 23-year-old assistant, sudden neck pain, stiffness after a rear-end car crash 2 weeks before. Classic whiplash.
Yep, very common injury mechanism.
So what stood out in her initial assessment?
Well, the immediate start of that pain and stiffness on both sides of her neck and the fact it was getting worse, that's significant.
And the headache?
Yeah, the new headache is also very typical with whiplash. Her pain got worse when she turned her head, especially quickly. And even just a 30-minute car ride made things flare up for like 20 minutes after.
Ouch.
She found some relief lying flat with one pillow. Warm showers helped a bit, but sleep was disturbed. Daytime pain was constant and increasing. These are all signs of, an acute injury with significant inflammation. Maybe her nervous system was getting a bit hypersensitive.
Right. And the physical exam showed her moving really cautiously, that forward head posture again. Widespread tenderness, muscle spasms, and limited and painful neck rotation and retraction. The initial thought was whiplash-associated disorder, or WAD, probably grade 1 or 2 because no neurological signs.
That initial diagnosis lines up perfectly with the WAD classification system, the Quebec Task Force 1. Grade 1 is basically just pain, stiffness, tenderness. Grade 2 adds musculoskeletal signs like her reduced movement and tender points. Since she didn't have neurological signs, it's not grade 3. And that high pain level after the car ride, that's a key symptom, like you said. It suggests inflammation, maybe that nervous system sensitization kicking in. The reduced neck rotation is another big thing to address.
So with this acute whiplash picture, what was the initial treatment focus?
Early on, it's mostly about reducing pain, helping those soft tissues heal, and gently getting her moving again, but only in a pain-free range. Basically, calming things down.
And what specific treatments were looked at?
Well, a big part is education and reassurance, letting her know recovery is generally expected. Then advice like staying relatively active walking is often better than sitting too long.
Makes sense.
Using just one pillow for sleep to keep the neck neutral. Maybe a short time off work if needed. Pain relief like NSAIDs, maybe ice initially rather than heat for the inflammation. And importantly, gentle, active range of motion exercises.
Active meaning she does them herself.
Yes, exactly. Often starting lying down is easier. The research generally favors active treatment, exercise, over passive stuff where someone else is doing it to you, especially long term.
Interesting. They were also careful to rule out a fracture with an X-ray. What other red flags or serious things were they watching for?
Yeah, after any trauma, ruling out serious injury is step 1. And so fracture was ruled out. But they'd also be watching closely for signs of the pain getting much worse, or signs of central sensitization.
That's the nervous system becoming overly sensitive.
Kind of, yeah, like the volume knob on pain gets turned up. They'd also watch for excessive fear avoidance, being scared to move because of pain, and any signs of post-traumatic stress. These things can really complicate recovery.
And her job involved a lot of sitting and computer use. Plus, she just started. That sounds tricky.
It really is a factor. Prolonged sitting puts strain on the neck anyway. And being new might make it harder to ask for changes or take time off, adding stress.
Absolutely. And she was worried, wasn't she, about recovery time, impact on work. How does that patient anxiety factor in?
Oh, it's huge in whiplash management. High anxiety can actually slow recovery. So providing that reassurance, clear explanations about the injury, the likely timeline, addressing her work concerns, that's all a crucial part of the initial care.
And when might they think about sending her to see someone else, like another specialist?
Good question. They might refer her back to her doctor for pain medication adjustments, maybe a psychologist if anxiety is really high, or potentially for treatments like CBT if those central sensitization symptoms persist.
The case also defined whiplash clearly and mentioned that WOD classification again. Why is that important?
Well, understanding the mechanism, that sudden acceleration-deceleration, helps understand the injury. And the WOD grades give everyone a common language to describe the severity, which helps guide treatment and set expectations.
So wrapping up the whiplash case, what were the key takeaways for managing it?
Okay, main things. Monitor closely, treat within pain limits, progress activity gradually. A thorough assessment is vital. How it happened. Symptoms, physical checks of movement, muscles, nerves, blood flow. Encourage staying active, avoid fear of movement. Good education is key. And often a mix of approaches works best. Manual therapy, relaxation, education, exercise.
And knowing when to refer?
Definitely. Refer for severe cases, COV-5, worsening symptoms, or any signs of nerve or blood vessel issues.
Okay, great. So we've seen two really different ways neck pain can show up. Now let's dig into the practical stuff, improving posture, finding relief. Our sources really emphasize that good posture is way more than just aesthetics, right?
Absolutely. Good posture, whether you're moving dynamic posture or still static posture, just fundamental for long-term health. It's not about looks. It's about preventing pain, preventing injuries, even other health problems.
Right.
Think of your spine's natural curves. They're like shock absorbers. Keeping them happy is key. It affects everything from muscles to breathing.
And the key is maintaining those natural curves. Not too much, not too little.
Exactly. You've got curves in your neck, mid-back, low back. Good posture keeps them neutral. Head over shoulders, shoulders over hips. That's the ideal alignment.
And the downsides of poor posture sound pretty significant, more than just a stiff neck.
Oh, definitely. It can cause musculoskeletal misalignments, extra wear and tear on your spine, chronic neck, shoulder, back pain, decreased flexibility, mess with joint movement, balance, even impact breathing and digestion. It's a whole cascade.
Wow. Okay, so what general tips did the sources give for improving posture day to day?
The advice was pretty consistent across the board.
Yeah.
First, just be mindful of your posture during daily activities. Awareness is step one.
Okay.
Stay active. Things like yoga, tai chi, core strengthening exercises are great. Maintain a healthy weight to reduce strain. Wear comfy low-heel shoes. And make sure your work surface's desk, counter, are at a comfortable height.
Let's zoom in on sitting, since so many of us do it all day. What are the keys there?
Okay, for sitting, change positions often. Don't just stay frozen. Take breaks, walk, stretch. Avoid crossing your legs. Feet flat on the floor. Maybe use a footrest. Shoulders relaxed, not hunched. Elbows close to your body, bent around 90, 120 degrees. And make sure your back's supported. Use a cushion if needed. And your thighs and hips are supported too.
Right, building on those basics for sitting. And how about standing? What cues should we think about?
When standing, think. Stand tall, shoulders back, but relaxed. Gently pull your stomach in it. Engage the core a bit. Weight mostly on the balls of your feet. Head level, like you're balancing a book. Arms hanging naturally. Feet about, shoulder width apart.
Now that term text neck or forward head posture comes up a lot. What exactly is happening there?
Yeah, text neck, it's basically when your head shifts forward out in front of your shoulders. This massively increases the load on your neck. Ultimately, the weight your neck muscles and spine have to handle. It's usually from looking down at phones, screens, poor desk setup, or just bad habits over time.
And the signs are?
Protruding chin, rounded shoulders, maybe more curve in the upper back, and the consequences: chronic pain, headaches, less neck movement, sometimes even breathing or jaw problems.
It's kind of scary how common that is. We're all probably guilty sometimes.
Absolutely.
So how do we even start to fix it? It feels pretty ingrained for a lot of people.
It takes a combined approach. You need to address muscle imbalances. Often the muscles in the front of the neck get tight and the ones in the upper back get weak.
Right.
Plus you need that postural awareness throughout the day, actively changing the habit. So stretching the front, strengthening the back, fixing your ergonomics, and consciously trying to keep your ears aligned over your shoulders.
And our modern lifestyle, sedentary work, tech use, seems like a perfect storm for neck pain.
It really is. All that sitting, looking down, it leads to these prolonged, unnatural head positions, creates those muscle imbalances, tight front, weak back. That's why workplace ergonomics, screen height, desk setup, and doing corrective exercises are just so vital now.
So how can someone tell if their own neck alignment might be off? What signs should you look for?
Well, obviously seeing that forward head or rounded shoulders in the mirror, but also persistent neck pain, tension headaches, feeling restricted when you try to turn or tilt your head, tightness or weakness in the upper back and shoulders. Maybe finding exercises like chin tucks or shoulder blade squeeze is difficult. Just checking in with your head position regularly is key.
Okay, let's get practical with exercises. What are some essential neck strengthening exercises the sources recommend?
All right, several types are important. Isometrics are a good starting point, gently pressing your hand against your head, front, back, sides, without letting your head move.
Yeah.
Build strength safely.
Okay.
Then dynamic exercises. Chin tucks are huge, drawing your chin straight back, not down. Gentle neck stretches, like slow rotation side to side, ear towards shoulder tilts. And don't forget the upper back and shoulders. Shoulder blade squeezes, wall angels. They provide crucial support for the neck.
And how often should you do these?
General advice is maybe 2-3 times a day, 10-12 reps each, slow and controlled movements. And definitely stop if you feel sharp pain.
Now, those deep neck flexors got special mention. Why are they so important?
Ah, the deep neck flexors. Yes, they're small muscles deep in the front of your neck, right near the spine. They're crucial for controlling fine neck movements, stability, and holding your head in that good posture.
Unlike the bigger neck muscles.
Exactly. The big superficial ones do the large movements. These deep ones subtly pull your head back over your shoulders. In people with poor posture, these often get weak, and the big muscles overcompensate, leading to strain. Weak, deep neck flexors are a big driver of that text neck.
So these exercises specifically target those weak muscles.
Precisely. They help wake them up and pull your head back where it belongs.
Okay, so how do we actually do these deep neck flexor exercises? The article mentioned a few getting progressively harder.
Yeah, it's usually a progression. You start simple, often lying on your back. The basic one is supine neck retraction. Lie down, maybe a small towel under your head. Gently tuck your chin towards your chest. Think making a double chin, feeling a stretch at the back of your neck, but don't lift your head.
Okay, just the tuck.
Just a tuck. Then you might progress to active assisted neck flexion. Same chin tuck. Then use your hand to gently help bring your chin closer to your chest, maintaining the tuck as you slowly lower back down.
A little help from the hand.
Right. And the harder one is supine cervical flexion. You do the chin tuck, then actively lift your head just a tiny bit off the floor using only your neck muscles, keeping that tuck the whole time.
That sounds challenging.
It is. The key for all of them is focusing on that chin tuck feeling, engaging those deep front muscles gently without letting the big superficial muscles bulge out. There's even a test, the head neck flexion test, where you lie down, tuck, and try to lift your head slightly. It shows how well those deep guys are working.
Interesting. So beyond specific exercise times, what can we consciously do all day long to help our posture?
Little things add up. Regularly doing quick chin tucks at your desk. Making sure your computer screen is actually at eye level, arm's length away. Consciously relaxing your shoulders down. Taking frequent stretch breaks, holding your phone up instead of looking down. And using a supportive pillow for sleep back or side sleeping is usually best. Avoid the stomach.
And for desk workers, those ergonomic tweaks seem crucial. Can you recap the essentials?
Definitely. Monitor at eye level, super important. Chair height, so your feet are flat and your back supported, maybe add a lumbar roll. Keyboard mouse position, so your hands and wrists are neutral, not bent awkwardly. And the big one, regular movement breaks. Stand, stretch, walk around even for a minute. Do gentle neck shoulder exercises during breaks.
What about some quick stretches for when you feel that tension building up during the day?
Yeah, some simple ones can really help. The upper trap stretch, gently tilt your head, ear towards shoulder, maybe add very light hand pressure. Levator scapulae stretch, turn your head towards your armpit, then tilt chin down gently. Side to side, neck stretch, again, gentle pressure if needed. Just remember deep breaths, no jerky movements, hold for maybe 15-30 seconds.
Prevention is always better than cure, right? How does just moving more help prevent neck pain?
Absolutely. Making movement breaks a priority is key. Incorporating exercises targeting both deep and superficial neck muscles helps build resilience. Gentle head nods back, like mini chin tucks, shoulder blade squeezes, thoracic extensions moving your upper back. These all contribute to better stability and posture. But as always, check with a healthcare provider before starting something new, especially if you already have pain.
And lastly, what about rest and recovery? How does that fit into keeping our necks healthy?
Good point. Rest between exercise sessions is vital. Ice can help reduce inflammation if needed 10-15 minutes. Active recovery, gentle neck rolls, more chin tucks can maintain mobility without strain. Massage or manual therapy can help persistent tension for some people. It's about balancing rest and light movement and really listening to your body.
And maintaining good posture long term.
It's an ongoing process. Regularly check in with yourself, make adjustments, Professional guidance can really help create a sustainable plan if you're struggling.
Okay, so just to wrap things up, it really sounds like neck pain can come from so many places, that slow burn from poor posture or sudden injuries like whiplash.
Definitely a wide range.
But ultimately, understanding your own posture, consistently doing those targeted exercises, and making those ergonomic adjustments, those seem like the absolute fundamentals for prevention and relief.
Couldn't agree more. And while everything we've talked about provides a really solid foundation, everyone's different. It's so important to listen to your body.
Be consistent with the healthy habits. And please, don't hesitate. Reach out to a healthcare professional if your neck pain just isn't getting better, if it's getting worse, or if it's really impacting your life.
Absolutely. And on that note, here's a final thought for you to consider. Based on everything we've explored today, what's just one small, doable step you could take starting right now to improve your neck health? Thanks for taking this deep dive with us.
Edited by Min.Rehab. Thank you all for listening, and see you in the next podcast.